So we'll know what Swept Source OCT is OCT with a speed of 100,000 A scans per second and has a wavelength of 1,050 nanometers. So the DRI OCT commercially available can allow us to penetrate deeper tissues and visualize the choroid and even the sclera very rapidly. We can get scans of 6, 9, and 12 millimeters. So in this prospective study, we evaluated 34 intraocular tumors, a variety of tumors, including choroidal nevi, melanomas, choroidal hemangiomas, choroidal metastases, retinal hemangioblastomas, and melanocytomas. And patients had a complete ophthalmic evaluation. So I'll just show examples of all these tumors. I think this is the best way to see the usefulness of this device. So for choroidal nevi, this is a dome-shaped lesion that is also associated to compression of the choroid capillaries and is associated with choroidal shadowing. There are some RPE irregularities that you can see here over the tumor associated to the presence of drusen, which is characteristic of the chronicity of these lesions, and there is photoreceptor loss as well. And the OCTA typically shows that these lesions are hyper-reflective. If you look at the lesion on the color fundus photographs, then you can see that on the OCTA corresponding to this lesion is hyper-reflective, and I will show some more examples like this one, hyper-reflective lesion. This has this one particularly here with subretinal fluid. This is the choroidal nevi, has a hyper-reflective ring with some lack of or hyperreflectivity centrally. This is another example, similar image. For choroidal melanoma, however, the image is a little different. It's a dome-shaped lesion as well, and we can see that there is also compression of the choroid capillaries. There is choroidal shadowing, but these lesions also have a lot more intraretinal edema, shaggy photoreceptors, loss of photoreceptors, and subretinal fluid is characteristic of these lesions. And the OCTA demonstrates that there is a vascularity that we could study depending on the pattern, and we're looking at a lot more cases to try to correlate these patterns with growth and also with the possibility of metastasis. And this hyper reflectivity of the vessels probably can be again correlated with prognosis. This is again in the center tends to be more hyporeflective in these lesions. This is again another lesion that shows hyper autofluorescence on the autofluorescent image. And here we see the lesion with subretinal fluid, the typical characteristics that we mentioned, and the vessels in the tumor. And then after treatment, the vessels will decrease in reflectivity because of the treatment. We can see here a patient with subretinal fluid, again in this image, and this is before treatment. And then after treatment, whether it is with TTT or with plaque therapy, we can see that patients can develop macular edema associated to radiation retinopathy. And here we can see associated to radiation retinopathy the presence of these telangiectatic vessels and microaneurysms, again characteristics of the disease. For choroidal hemangiomas, this is a lesion that is dome-shaped and is associated with chronic cystic changes. There are also chronic RPE changes. There is no compression of the choroid capillaries, so OCT can help differentiate these lesions from malignant lesions, and there is dilated choroidal vessels, and this is the hallmark of the OCT appearance. on the structural OCT because of these large vessels in the choroid that these hemangiomas have, correlating with the histopathology of these lesions. So here we have an example that shows that on the OCT there is a lazy hyper-reflectivity of the vessels, but the areas with lack of flow could represent also large vessels that do not show flow because of the velocity of the flow in those large vessels. The vessels are, some of them very large, some of them smaller on the histopathology of choroidal hemangiomas. Subretinal fluid, intraretinal fluid on a patient before therapy, and this is another patient with fluid. And after treatment, the pattern of the hyper-reflectivity of the vessels changes with a decrease in the periphery in some patients of these vessels, with still some vessels in the central part of the retina. But I'll show you another example. This is another hemangioma with, has been treated with PDT in 3 opportunities. You see the extensive subretinal fluid, and the OCT shows a pattern of hyporeflectivity centrally with a ring of hyperreflectivity, demonstrating lack of vascularity centrally, or maybe the vessels have been dilated. The choroidal metastasis is another different lesion that can be shown on the OCT to help to differentiate. It's a lumpy, bumpy contour lesion, and there are granular changes of the RPE. There are empty spaces between the neurosensory retina and the RPE, and there is a smooth transition between the normal choroid and the infiltrated choroid by the tumor. And there are hyperreflective points in the external retina on the tumor, and we had described that on OCT years ago as well. And we can see this presence of these hyperreflective points in the external retina. This is another example that shows the metastatic lesion and the hyperreflective pinpoint lesions on the retina with the bumpy appearance and the subretinal fluid. This is after treatment. Again, these patients can be treated systemically or can be treated with PDT or TTT. And when these patients are treated, then we can see that we have better visibility of the choroidal vessels because of atrophy of the RPE. And this is seen on other examples here. This is before treatment, demonstrating the vascularity, and subretinal fluid can mask the vascularity in many of these cases, but the vascularity can be seen much better after treatment. This is before, and this is after. This is before treatment, and after treatment, you can see how there is these lesions show the vessels of the choroid much better. So there is not a lot of vascularity that we can see with the before therapy in these tumors. They tend to be hyperreflective, but then after the treatment, we can see a lot of vessels, large vessels of the choroid, and we can see some more examples here before and after treatment. So for melanocytomas, it's a bilobular mass with highly pigmented choroidal vessels protruding through the lamina cribosa, posterior shadowing, cystic changes between normal retina and the melanocytoma, which is the lesion here. And these lesions show on the surface of the tumor hyperreflectivity of the vessels of the tumor on the surface. And this is another example of another patient that here the structural OCT shows the lesion on the optic nerve, and then the OCTA shows relatively hyporeflectivity of the lesion, but there are some superficial vessels that can be seen here as well. And we follow these vessels for surveillance of possible malignancy transformation. For hemangioblastomas, generally it's an exophytic mass protruding from the internal retina. There is exudation, as you can see here, and the large vessels from the optic disc can extend to the periphery, which are the classical feeder vessels, and there are cystic changes between the large vessels, and there is also hyperreflective dots on the external layers of the retina that correspond to exudation, and the posterior hyaloid seems to be, in most of the cases, very strongly attached, creating traction in these vascular tumors. This is another example demonstrating the feeder vessels and the peripheral hemangioblastoma here with subretinal exudation, and the OCTA shows very well the presence of the feeder vessels. And this is another example that shows the small lesions and the presence on the fluorescein angiogram and then on the OCTA. This is another patient that has small lesions here on the fluorescein angiogram. This left eye had been treated before, and the OCTA can show the presence of the hemangioblastomas very well. So in summary, Swept Source OCT provides an accurate measurement of thickness and diameter of intraocular tumors, provides a view of the inner structures of a series of intraocular tumors, and assess their associated structural abnormalities. Swept Source OCT, I think it's like an optical biopsy of intraocular tumors, and I'll explain why OCT can be similar to what we got with ICG angiography, where we could differentiate benign tumors like this circumscribed choroidal hemangioma with typical features of hypercyanescence and washout of dye in the late phases of the ICG angiogram, and also the different patterns of vascularity of melanoma can probably predict in different studies. This is from Arthur Mueller that correlated these lesions that have been seen histopathologically as well to be correlated with growth and metastasis by Folberg. So OCT may help differentiate benign versus malignant tumors and may help in diagnosis and management of intraocular tumors. Thank you so much for your kind attention.